I was the founder and CEO for a company called Medavance, which kind of created the field of what we defined as therapeutic temperature management, actually using temperature to improve an outcome for patients in critical condition. Built it into a nice company that developed a product called the Arctic Sun, which is kind of the gold standard in the therapeutic temperature management business now. I've always been in the healthcare field and medical devices, and Medavance was the first company I decided to start because of the critical need and the potential for cooling therapy. I have a scientific background and worked for some big medical device companies in surgical fields and the ICU, and was just generally in the space of small company startups and doing business development for the big company. Kind of fell in love with the small company environment, decided I wanted to try to start one myself. What I was really attracted most to is I think it solves the one last big problem in temperature management therapy, and that is for most people they have to be highly sedated in order to withstand the therapy and be comfortable enough that the therapy can do its job. So that limits the application of the number of patients who can actually receive the therapy. And the way NeuroIntact is approaching the problem through its nasal cannula and not having to cool the surface, it opens the opportunity to do awake patients. Doing that will increase the benefit of temperature management therapy to a much larger number of patients. And I think the NeuroIntact is going to make a significant difference in the space of temperature management. Over the next 5 years, I think this is going to become standard of care in a lot of settings, especially in the intensive care unit, where today it's more of a select number of patients to get it. I think most of the patients in the ICU who have any type of fever will all be treated with this type of technology, and therefore I expect to have much better outcomes.